Local health and service data and information helps us build a picture of what's happening in Clarence. Here are some things that we're learning. Service providers struggle to have a complete understanding of what services and support is available, finding it unclear how they connect and relate to other services. People are confused and unaware of what services and supports are available to them, who is eligible, and what the process is for accessing them. Some of this confusion involves knowing how to find a bulk billing GP and who can access neighbourhood centres. In Clarence, lots of services and groups are working hard to connect with the community, offering information sessions in many different settings. There are some important services based in Clarence, such as Community Nursing Services, Clarence Plains Child and Family Centre, Clarence Integrated Care Centre, and non-government organisations. However, many other services are only visiting services. Limited outreach of services to outlying areas can mean people are not getting the ongoing care and follow-up they need. The Help to Health project is helping to improve awareness about health and helping to connect people and services through the 4 initiatives: It's OK to Ask, Clarence Talks, Help to Health Friends, and The Right Place. People are going to pharmacies for medical advice instead of the doctor. They may not be able to get there, or they can't afford to go, or can't find a bulk billing GP. Here's what we think is happening. Information on health, well-being and local activities is shared via social media platforms such as Facebook and on websites. Online health and well-being support, such as Health Direct and Symptoms Checker, is available. We are unsure who is using these services. People have said there is a lack of information sharing between and about services. This can lead to people needing supports being passed through services that aren't suitable to them. We are beginning to see that there is better sharing of information if services are delivered from places that people know, trust and feel comfortable in. This may be a centralised medical service, community centre or neighbourhood centre. There is a lot of information about health and well-being in many different forms in the community. But we don't know how much information is online or in written form. We are wondering if it's accessible to everyone and who may be missing out on the information they need. We'd like to learn more. There are many things that stop people getting the service and support they need when they need it. What can be done to help people if they can't get into a service? Are there things that can be done while they have to wait for a service? What else is available as an alternative? Who can provide people with this information? Do people feel confident asking questions? And are their questions being answered? There is lots of information available, but are we getting the right information out there and is it working? Lots of organisations and services have community engagement workers. Are these workers a potential resource that we can better utilise? And if so, how can we better support organisations and services to do this? We want to know where you get information on what is happening in the community, and how do you get your health information? How useful is the information that you are getting? There is also confusion and lack of information on different types of medical services, treatments and procedures. Is there a need for more information about the roles of specialists and allied health professionals, tests and procedures? Is a lack of understanding about how health services work stopping people from using health services? Would better information lead to better use of services? What do you think?